Hello, welcome. There are 5 things to do when you are first diagnosed with diabetes. First is to track your blood sugar or your blood glucose. Data is information to help your doctor decide what to do. It's also information for yourself to know how things are going. Monitor your blood sugar. Hopefully you have a blood glucose meter. Hopefully your doctor prescribed that and some blood glucose test strips. If not, you can buy one at the pharmacy. You can watch YouTube videos on to figure out how to use it. It's really pretty simple. Check your blood sugar at least once a day. Generally, that gives you an idea of trends over time. And to have an accurate representation, it would probably be best to check it roughly the same time every day. Usually, fasting blood glucose is the recommendation. So this is before you eat any food. Check your blood sugar in the morning after you wake up, and roughly around the same time or the same time after waking up, since when you wake up in the morning, blood sugar might rise. This is called dawn phenomenon. It's very common. So depending on where you measure along that curve, if you're using a blood glucose meter, you will get a different result. If you have guidance from your doctor or you have enough blood glucose test strips to do more frequent testing than that, you can also test before a meal and 2 hours after a meal, and maybe to get a idea representative over time. Maybe on like one day out of the week, you might test after lunch. Another day, you might test after dinner. But 2 hours after the meal will usually show you good information about what your blood sugar has done after the meal. So definitely track your blood sugar. If you can get a continuous glucose monitor, a CGM, that's another alternative which gives way more information. And if your blood sugar you're really having challenges with managing your diabetes, especially if you're getting low blood sugar, a CGM can be really helpful because it can warn you before the low blood sugar happens. But a CGM gives you a graph because blood sugar changes all the time. A CGM gives you an idea of what your blood sugar is every 5 minutes. So it's a lot more information than doing a blood test. So that's becoming more accessible. The number 2 thing, if you have diabetes, is do some exercise. If you're not already doing exercise, even a simple 15-minute walk will have a big impact on your blood sugar. Any way that you can add exercise can help with blood sugar management. So parking further away from the store, so you walk to the store a longer distance, is one way. Taking the steps instead of the elevator. Just walking for 7 minutes in any direction, turning around and coming back, doing that once a day. That minimum amount of exercise, surprisingly, I can see that makes a difference on days when I do that and when I don't do that. And then if you really want to gear up and try to have the most impact possible from exercise, longer duration of exercise and muscle building is great for really significant impact on blood sugar. But any exercise is better than no exercise. Number 3, changing your diet. Of course, this is probably the big thing you're already thinking about. The carbohydrates in your diet, those are the things that have the most direct impact on blood sugar. So generally, the recommendation is to decrease carbohydrates or carbs. These are things like potatoes, rice, and bread, and increase protein and fiber. And if you have carbohydrates, complex carbohydrates, which have fiber in them, instead of simple carbohydrates. I don't think you need to change everything overnight. I think just taking one meal at a time and thinking, how can I improve this meal? And gradual steps is the way to go. But some people may want to buy some books about cooking low carb diets and follow those books right away and change everything. But it really does not have to be a huge change all at once. Some small steps. For example, cutting out sugary drinks. That's one easy thing to do. No more soda or juice or anything unless you have low blood sugar, but not as a regular drink. That can really reduce carbohydrates a lot. And then also reducing portion size of the carbohydrates. Like I can still eat some potatoes, I just don't eat as many potatoes as I would have had before. And then I have more protein and vegetables. Salads are great, but some people don't want to have salads all the time. I can totally understand. I have a medium carb diet, And there's nothing that says that you have to go super, super low carb, but making some changes there and recognizing that if you have diabetes and carbohydrates are really the most challenging food for managing blood sugar. Number 4 is try to reduce stress. The stress hormones tend to increase blood sugar. So it can be very stressful to feel like you just got diagnosed with diabetes and your world is changing. And that stress is something that needs to be coped with. And then any other stress that's in your life, anything that you need to take care of to reduce your stress levels, that will have an impact on blood sugar. So think about what that could be and what kind of problems that you can address in your life. And then how to cope with the stress, because there's always going to be stress. There's no such thing as no stress, but when the stress happens, how do you cope with it? Do you do some deep breathing exercises, some meditation, listen to music, some art, some journaling, relaxation? What can you do to bring down the stress levels? Sitting at a high chronic stress level is not good for your overall health. So I do not believe you can treat diabetes without also treating mental health and addressing other needs. If you are in desperate need of money, for example, and you're very poor, that needs to be addressed and figured out, and get a support system and figure out who can help you. And number 5, give it time. If you were just diagnosed with diabetes and you were prescribed medication or insulin or both, these things do not work overnight, especially, to get the dosing correct for insulin can be very challenging. So the initial dose may not be the right dose. It may need to be adjusted. That's more than likely the case for things like metformin medication. Sometimes that can take quite a while, like metformin, 3 weeks before the full effect from metformin can be seen. So can take your medication as scheduled, but keep track of your blood sugar. And if you're going low because if you're taking insulin, or if there's other reasons that you're getting low blood sugar, check that blood sugar and write down what that blood sugar is. And if it's happening repeatedly, talk to your doctor about it. Needs for your blood sugar changes all the time, and how much insulin you need or other medication can really change at any time. So that's why, going back to the number 1 thing, to track your blood sugar, to test your blood sugar, and keep a journal, a log, and then talk to your doctor. Hopefully your doctor can be reached online through like MyChart, and you can write to them, and there should be no reason that you need to wait until the next appointment. That might be like 3 months down the line. Work with your doctor sooner than that if your blood sugar is staying high, or if you're getting low blood sugar, which can be very dangerous. Low blood sugar in the short term is very dangerous. High blood sugar over time causes all kinds of problems, of health problems, and that's why managing blood sugar is so important to prevent those long-term health problems. But also low blood sugar, which can be a side effect from too much insulin, is extremely dangerous as well. So as much information as you can provide your doctor will help them to adjust it. And if you think you might have been misdiagnosed, or you're not sure you have the right diagnosis, make sure that your doctor has tested for antibodies, or ask for that, or ask for a referral to an endocrinologist. And check out my interview with Dr. Ponder that goes into great detail about the different types of diabetes. There's a lot of different causes of diabetes, and depending on the cause, the root treatment is different. Thank you.